in. Take out. Out. Here, look. Whoa. There you go. All right. Okay, so we are doing this video today to talk about W sitting, which this is Rosie, my daughter, and she frequently does. And as a therapist, this is something that I'm aware of with my kids that I would treat and I educate parents on. And this is Ashleigh, our OT. She's going to give us some information about W sitting and why it's maybe not the best position for your kid to sit in. We have Rosie here because she, like I said, she does it, but she a lot of times will use it as a transition. She'll be sitting like this and then fold into the W sit, and sometimes she'll flex out like this. Which Ashleigh has told me not to freak out about, as long as she is using it as a transition and she doesn't sit in it for a really long time, then it's fine. But she's going to tell us about, why it's not maybe the best position for our kiddos to be sitting in.
So that's exactly what I was going to say, is as long as it's just used as a transition, or she's sitting in this position for just a few minutes, it's okay. It's when kids are in this W sit position, when you look up above, it looks like a W with your legs. That's when it can be concerning. Sitting in this position we have a larger base of support, so our whole body is supported. We don't have to use our core muscles as much. And then there's really no trunk core activation when we're doing our twisting. So when and another thing too, with this position, it can cause tightened muscles here in the inner legs, which will then cause the hips to turn in, the knees to turn in, and then those toes to turn in too, which can cause issues as the child gets way older. So if you see your child sitting in W sitting, just observe them for a few minutes, see how they're doing when they're playing. Encourage them to come over here and get this toy, which pulled them back out of the position, and then once they sit back down, see if they get back into that position. If they are, then we want to encourage them to do a more functional sitting position. They can sit up on their feet like this. We can do side sitting, we can do legs straight out in front, we can have our legs curved like this. Any other more functional sitting positions that's going to activate those core muscles, help strengthen those core muscles, and help with that balance and everything too.
Okay, so Ashleigh, what about this? What about she'll frequently do this? 1 foot out and 1 foot back like this.
So that's similar to the side sitting position, which side sitting is a good functional position as well. You're still activating those core muscles. It's probably long-term isn't going to be all that comfortable to sit like this. So again, the same type of thing. If she's sitting in there for just a few minutes, okay, but then I would bring that other foot around too, and help her get into a better sitting position.
Okay. Yeah, so we brought her in for the video today because she does it all the time at home, and now she's going to be like, look at all these wonderful other positions I can demonstrate.
Of course, she's not doing it, huh?
Yeah. And then I think Lisa, our PT, said sometimes it can be indicative of low tone.
Sometimes, yeah. Either that or just low core strength too. They're trying to stabilize those tummy muscles so they don't have to use them as much when they're playing.
Yeah, and core is also important for our feeders and our talkers. You need good core strength for breath support to get good vocalization and good respiratory support for safe eating and swallowing. So, all right, thank you so much for sharing, and hopefully that helps all you guys. So, just some alternate sitting positions. And if you see your kids sitting like that, just try to encourage them to sit other ways. Thank you so much for watching. Rosie, you say bye-bye?
Bye-bye.
Bye-bye.